are here with Miss Dolly Davar. She's a director pharmacist at La Clínica de la Raza, and she has 20 and more years of experience with La Clínica, and it's such an honor for us. Here we are Anaís Roata. This is our assistant researcher here in the center, and myself, Clara Mantini Briggs, co-director of the program. We are left the micro to our guest, Miss Dolly Davar. You can come in.
Well, hello, Anais and Dr.
Clara.
Briggs. Very nice to be here. And do you want me to start, or you going to ask me a question? However you want to do it.
Yeah, but first we wanted you to say your name and say that you are
Okay.
in agreement.
Oh,
And
yes,
agreement
this is
con-
Dolly Davar from La Clínica de la Raza, and I would love to interview with you guys here today.
And you are agree with the use that we can.
Yes, you
do-
can use the microphone and you can use the video recording wherever and as ever you
For
need to use for your research and
for the project, for the uses
Yes,
of the project.
yes.
Okay, thank you very much.
no problem.
Well, today is 12,
13.
13.
We're doing it on
Yeah,
Friday the
I'm
13th.
behind. Yeah, today is September the 13th, 2024. And saying that we will begin with the question. Do you want to do them first?
Yeah, sure. So we just want to know about some early background about your life and your family, and particularly about your formative years.
So I was born and brought up in India. I was born in the state of Mahatma Gandhi, if you remember him, the freedom fighter in India that actually fought for freedom from colonization.
Mhm.
That Britishers ruled India for 200 years. So I was born in his state. I'm very proud of being born in his state. Came from a pretty middle class family where there was a lot of warmth and love, and we grew up in joint families. I had my grandparents, all my uncles and aunts while growing up. I think my dad was very progressive for his times and was also very much into community service in terms of he himself used to work for a bank and he was before that a professional cricket player, but always had a very big heart, and we had an open house policy, like starting in the morning, and my mother was his partner in crime because he could invite people, but my mother was the one who would make sure there was tea and coffee and snacks and everything, and so that's how I grew up. And so I think my dad was a huge huge influence later in my life in terms of how I ended up at La Clínica, for sure.
Yes.
Yeah. And I remember vividly, he would help anybody, even from the street. He would say, come home, come sit with us, eat with us. And, so I think that was a big influence on me growing up. And he was also the one who told me that, look, as a woman, as a girl, I would want you to be economically independent. And he's no longer there. He's gone for almost 22 years now. But I think as when you grow up, that's when you know that there was this profound influence when you're growing up that kind of helps you navigate your life in a meaningful way. And so I would both my parents growing up were a big influence, and he was very, very instrumental in making sure, because I used to dance when I was younger, and I had this opportunity to probably dance as a professional dancer till I was about 18 years old. And it was my dad who sat me down one day and said, look, dancing is good, but you should get a professional degree. There's no substitute for that. For a woman, for a girl, economic independence is the ticket to freedom. So good education is your ticket to freedom, and dance is a hobby. And he said, get a degree, and after that, if you want to dance all your life, I will not stop you. So even now, when I think how it all happened, big part I credit to my dad and my mother, of course. Like, she actually made things possible. Like, he would bring people, he would help people, but she was the one doing stuff in the back.
Yeah.
So I think it's good that I got that not too much materialistic stuff, but a lot of grounding in terms of how important human relationships are, and that all came from my dad. So yeah.
That's amazing. That's a great gift that you have.
Yeah. Can I just take a Kleenex because?
You want me to go to?
No. I think I brought, because I know I might cry.
Yeah.
So.
To see how this is going.
Can I ask what you decided to pursue, and when you decided you wanted to get your degree?
So I promise I'm not going to cry anymore. I just remember my dad and I.
No, it's good. Crying is good.
Yeah. So in the way it works in India in those times were that there were only state-owned universities. There were no private universities in India. I'm talking about when I was going to college, when I was applying in 1986. There was no private universities. They were all public universities, and based on your merits, like based on your grades and GPA. And this actually, the process starts in high school. So like for me, started in 1982 because I, in middle school and elementary school, loved biology a lot. And so just based on my love for biology, I said, okay, I want to opt out for sciences. So in high school, I opted out for sciences. And then in 12th grade, whatever you get as your GPA and everything, based on that, the government decides your qualifications, where you are eligible to go. So I did not get into engineering school, I did not get into med school because my grades were not at that level, but I did get into dental and I did get into pharmacy. So I had two options. The reason I personally didn't choose dental was I was not very good with needles and blood and things like that, and my dad sat me down and said, look, you will be operating on people's mouths all the time, and that requires a lot of tolerance, and you can't be fainting there, because you may have to give like numbing injections. And I always had this, like, even if I had to go draw blood, I don't look at needles. Needles were a problem for me.
Yeah.
So then the choice was very easy. Pharmacy. So that's how I ended up in pharmacy, and ended up loving it because it had right amount of biology, and I was okay with chemistry. So we did a lot of organic chemistry because we were taught how to synthesize drugs, the chemical compounds that can be potential drug molecules. So we learned about that, and we also learned about a lot of natural medicines that came from plants, and there was a field, the name of that particular field is called pharmacognosy. So I got to learn a lot about ancient remedies that were invented just from nature, and how nature has abundance of so many things. And chemical drugs that are now invented are a lot of times based on the plant-based structure, like that comes from natural. And even now, like a lot of things come from natural stuff. So
It's easier for your body to
yeah.
metabolize, right?
So that was the reason I went to pharmacy school.
And then how do you decide to come to the United States?
So again, my dad, like I said, he was very progressive, and he actually was very patriotic, I would say, as well, because he wanted to stay in India. His brothers now, three of his older brothers, were in the United States since early 60s, because my dad's dad was very progressive, outlooking, where the opportunities were. And of course, India, if you're educated, the opportunities were not as much. So when I came out of pharmacy school, he, even though he never wanted to leave the country, he, did encourage me and my brother both actually, that, at least go study.
Yeah.
You will have a better perspective. Research in those times in India was very, very minimal. It was about, at that point when I was growing up, India was at least maybe, if not more, 50 years behind any Western or any developed countries. So for us, even after you got, say for example, a professional degree, you'll find a job, but you'll be very, very kind of stagnant in the job. There's no growth because there's not any research done, so there's no kind of opportunity. So that's how my family encouraged, and then my uncles were here as well, and they came to do their undergrad a long time, in the early 60s, because they all were engineers, and they came to this country. So my dad was saying, okay, at least you have some family there, so apply and see where you get in. So that's how I came to this country and came to do my master's in pharmaceutical sciences.
And what university?
This was University of Toledo in Ohio. Yeah. And so I came from a nice tropical country into a very cold place. Super excited though, because America was one of those countries, even for a long time ago, where there are a lot of opportunities, and so yeah.
The American dream.
Yes, I think I have lived that.
Yeah.
I'm eternally grateful to the university, the professors, people. They were really nice here when I came, at least. And I think one thing I'm very thankful about the colonization is that we did learn English, and it opened up some doors, because the language, the ease of speaking the language and being educated in English medium helped. So there's always some good and some bad to any situation in life. So
Well, pressure, it's kind of understand. And then you come here to did your continue your master.
So I finished my master's, and then did, like I said, I had to take the foreign pharmacy equivalency exam, which I did after I finished my foreign pharmacy equivalency exam. California had the toughest clinical pharmacy board exam. So it was like I had to take, I said I'm not going to, I just, I'm one of those people. I have all my, excitement and enthusiasm and all the hard work. The first time I do anything, I'm like at a different level than if I repeat the same thing. So I just took this Kaplan classes, I remember, when I came to California. And I used to drive to San Francisco, and from Mountain View, that's where I used to stay in. So did my exam, and then had to do the law exam, finished that, and then because I first had my license on the East Coast, but that was not valid in California. California always has its own rules. So I got my license. I used to work in the retail setting, and I'm sure there are some questions that probably will let me address that as well. But I started working in the drug retail pharmacy. I enjoyed, I had a very good mentor when I first started, so kind of dedicated to his patients, did a good job. And we're talking about the early I started in 92 as an intern, and 93 as a pharmacist, and then I was working on the East Coast for 2 or 3 years before I came to California in 96. So my journey did begin in like Walgreens or Rite Aids or whatever you call as a regular retail pharmacist. But as time went by, there was, like I said, something was missing. I was not happy at the end of the day of the contributions I was making. And at one point I told my husband, I feel like I'm selling my soul every day. Because even in those days I felt that, because yes, healthcare, it's, if you're working in a retail pharmacy, it is business. But business is there, I know that people have to be paid and everything, but I felt like I was not having the opportunity to really make a difference in people's life at any level that I actually wanted to, because it was all about, get that prescription out and get it done, but not being able to really answer many questions or hold hands when required. So by 90, in late 90s, I would say, because I used to work part time, because by 96 I had my daughter by that time, and so I would work only 2 days a week, 12-hour shifts, and after, I think I pretty much worked almost like 10 years before I said, you know what, and when I came to California, I think things were really doing well, like, I remember Google, Apple, Netflix, Netscape, Cisco's, all these were like at their peak in terms of the internet was coming in, and I'm like, oh my God, is there even a not-for-profit organization in a place called Bay Area, because you were just hearing about how many like stock people were making money in stocks and this and that, and right. So I think it was, there was nothing like, the internet was there, but it was in a very rudimentary format, like there was no, you couldn't apply for jobs online or anything like that. It was still the paper, I used to look for advertisements and job openings, where do I want to apply? And I think it was in 93 that I couldn't find anything in the papers at all, like that had anything to do with any sort of not-for-profit or anything like that. So I remember calling a recruiter and telling him, hey, listen, I'm sending you my resume. If you find anything that has any angle of, where you have community service, some sort of a not-for-profit, setting, then I would love to work. And I remember he called me after almost 8 months. And he says, Dolly, there's an opening at La Clínica de la Raza. And see, I think research was not as easy as you have on the internet now. Even you didn't know what to search for, to tell you the truth. At that time, I was not as savvy, So the recruiter said, okay, I'm going to look for you and I'll call you once it's there. So I remember I got a call in June of 2004. And I remember being interviewed. I came and I'm like, yes, I'm going to do this. And I remember, I don't think so I talked to Jane, but I talked to the director of HR, Pat Roybal, who used to be very good friends with Jane Garcia. And then
What is the name?
her name is Pat Roybal. She retired, I think, about 15, 20 years ago now. Not 20, maybe 15. After I came, she was there.
He's alive.
I think so. And it's, you can check with Giovanni, he might be able to get in touch. She was the one, and she told me about the story about this place. And I remember, just going back home, and then I told my husband, oh my goodness, I didn't know that there was so much need, because they told me what all they do, and which communities they're serving. And I said, oh my God, this reminded me of India, I said, because it looked like when I came to Oakland, because believe it or not, I never came to Oakland when I was with the school. Lived in Mountain View for a little bit and then we were in Fremont, but I never really ventured because little kids and stuff, you don't have time to go to. I don't even went to the city like San Francisco. Maybe I went like one time. So busy with kids and work and all those things, there was no time to really do all those things. I'm like, oh my God, this reminds me of India where there's so much need to help. Because India had so much of poverty, and even though we were middle class, when I stepped out, I could see like people living in, slums and all kinds of stuff, and there were big, huge public hospitals in India. That's where people used to go, and healthcare access in India was cheap, because that's one thing that I would credit the government, give credit to the government, that no matter what the struggle was, patients had an avenue to access help, like basic primary care, which was missing in this country. Like I said, when you have a job, then you are in your own bubble because you have insurance through work. So there's no reason for you to think about, people that don't, because you feel like, oh, everybody's working, that means everybody has insurance, but that's not the truth.
Yeah.
A lot of jobs, like small businesses, don't have to offer, and then I never had a small business, so I never thought about it. That, oh, maybe small business people, where people work as a waitress or whatever, they don't have insurance. because your exposure is so minimal when you're coming from other country, you're trying to struggle to make your, that you don't really pay attention to all these small details until you actually come and work, and then oh my goodness, such a massive gap out there, and there's so much need for this kind of stuff.
Yeah.
So so that's how the journey began with La Clinica, and I still remember July 19, 2004 is when I started.
Yeah.
So 2024, so 20 years.
Jesus, that sounds sort of number 2. How about number 3?
Yeah, so how long did you work at La Clinica, and how has your involvement sort of changed over time as you worked there?
So I came, so my position in terms of my title has remained the same for 20 years, but I remember I came from a very retail background where I was not sure exactly what my role is going to entail in terms of on a daily basis. So I remember the first day I came in, and the head of pediatrics, Dr. Proejct, called me. He's like, Dolly, I know it's your first day at work, but I don't know what happened in the pharmacy yesterday. This, pediatric patient's parents were there, stopped by, picked up some asthma medications along with a nebulizer, and I don't know what your pharmacist did in terms of making sure that they understood how to use the nebulizer, because the baby ended up in the emergency room because the parents did not know properly how to use the nebulizer. And this is my first day, this is my first call. And I said, Dr. Proejct, I will make sure to have a meeting, in the next few hours to make sure that something needs to change. I said, I don't know what happened yesterday, but I said, I assure you this will never ever happen again. So that is my responsibility now. So I remember that first day, right at lunchtime, I'm like, guys, because we always have this 15-minute cushion before close the pharmacy, or 15 minutes to make sure we clear up everything for the next leg. And I said, let's have a meeting. This is my first day, and I just wanted to set some basic, expectations and the tools that I can offer you. And I said, I also received this call from Dr. Proejct. I said, I don't know what happened, but starting today, I said, I'm going to dedicate one pharmacist to make sure that his or her job is only doing patient counseling and consultations on medications, devices that we are giving out, and we made a little corner which was already there, which was not being used properly. So this is where we're going to sit down. This is where we're going to make sure they're not going to miss anything. So that was my first day, and that's when I kind of felt the gravity of the situation. So on my research later about what happened to this particular patient was, the parents were very young, and the parents were probably refugees, did not speak the language, and the pharmacist, I don't doubt, had explained, but they did not understand properly. And the nebulizer, they did not put the little mask that goes on the babies, covers the nose and the mouth so that they can inhale the the medication, the mist of the medication. So they thought they can just turn it on in the room, and the baby's going to get the medicine. And the baby didn't get the medicine. Luckily, at least they took them
to the
ER.
emergency.
At least they had that. That was in the middle of the night.
Scary.
Yeah. And so that was my first day, and that's when I said, there's so much that you can do here, so much. And the hand-holding that is required is your opportunity to help everyone in the best possible way you can help, and try to make it as foolproof as possible when that patient leaves the pharmacy, so that the treatment outcome is superior.
Yeah.
So that was my first day, and so I really think that I was fortunate to have that experience on my first day, because it made me set my parameters right. Say how important it is. It's not about how much you know, it is how much you can communicate well to any level of literacy, cognition, doesn't matter who's sitting across from you. It's your responsibility to make sure that they understand what you're saying. So that day and today, that hasn't changed. Yes, did we not make mistakes? We have. Did we have incidences later? Yes, of course, because we are all human beings. But the goal every day is to make sure that we give, again, culturally sensitive, appropriate in terms of their literacy level, their demographic, whatever it is, the best way we can. So that every medication that's handed over brings out the best treatment outcome. You know, so it's just not a tablet that you're giving, it's just not a liquid that you're giving out. It's healing that you're giving out in terms of that, so that they feel better. But if they don't understand how to take it, when to take it, it's not going to work. They're going to end up in the emergency room.
And that's why we bring you here.
So that's why we want the primary care setting, and a good quality primary care
Yeah.
setting. So yeah, so I feel very fortunate that I started my first day like that, because that set me up for the entire career. That don't take, take it lightly. This is healthcare for patients who really need hand holding. And where else can you use your knowledge? Clinical, where else can you use your compassion? Where else can you use your empathy? If this is not the setting, then where else? So I hit the lottery in terms of selling the soul to using my, you know, spiritual or the self to give service.
Your knowledge to
Yeah.
do those
So
details.
it's a package that I landed up in, and that's the best package that I've found is, you know, you get paid, yes, every place you go, it's a certified profession, you'll be paid almost the same. But the goodwill that we gather, there is no price on that. So
That's really good.
yeah, so that's what La Clinica does for me. And it has grown, and I've seen so many patients that, and I have a few patient stories if you would like later on to, you know, maybe one or two I can share, that you feel, my goodness, you know, that you have been given this opportunity.
And that is
Make-
comparable with the legacy of your father. You're doing
Yes.
something.
Yes, that's what I'm saying, that you don't know how the positive and the negative influences when you are a child influence you.
Yeah.
And therefore, it's so important that children are,
Beautiful. Beautiful.
I had a follow-up question if you thought like there was like a language barrier in like the pharmaceutical industry, like you said when you were first starting out, like they didn't really understand. Did you feel like it was ever difficult to communicate with your patients?
No, so we have fluent Spanish speakers that, so my language skills, so I will be able to do like a consultation because it's more of a medical stuff, but I have everybody speaks Spanish. And we also have, it is a barrier if you think it's a barrier, but what that first day told me was, unless until they're able to demonstrate, if it's a device, they should show us how you will do it at home.
Yes.
That's your proof. So when we know that the seems confusing to them, they say, okay, show us what we told you. And this is all in Spanish, it's not in English. So sometimes it's a good idea to have them now, so when we hear the nebulizer, we'll say, okay, we explained it to you, show us the steps, tell us what you're going to do, how you're going to do it.
Yeah.
So we learned. So now we just part of our workflow. Anything new that is given out, and if the patient is, we know that is, you can see body language is a big thing. You can see that they're really confused. Sometimes they might not be assertive and say, oh no, I did not understand. So we say, okay, just give us a demonstration of what we demonstrated to you. So then it becomes clear, oh yeah, they are able to know this wire goes here, this goes here, this goes here, you know. So
It's really
important, yeah. So we do that with all like the metered dose inhalers, any of the discuss that, you know, how they have to inhale or anything that goes in your nostrils or any other part of the body. We make sure they understand which part of the body it's going into.
Yeah.
So our consultations are not like what you experience at Walgreens.
Yeah.
Or
they're
CVS.
more like yours.
Oh, do you need a consultation? That's not the question.
Yeah.
Every new prescription is said you please go to the next window, the pharmacist is going to do a consultation with you. It's not a question, do you want the consultation?
Yeah.
You are getting a consultation. And so even for refill prescription or anything, we always ask, hey, even if it's a refill, I know it's not requiring a consultation. If you have something, so our reception staff constantly does that. So they can ask any question. And therefore, like I said, in the big picture, it's a good thing because we have one dedicated pharmacist, so we know at least whatever has gone out, the patient understands what they're taking.
Yeah, I know it's
Yeah.
very important. Later, when we finish the interview, I will tell you an anecdote
Yeah.
about my work with people that didn't know how to deal with the medications.
Yeah.
But let's go to the fit.
Yeah. So you said that you came, you started working, or you came to California in like the early 90s.
Mm-hmm.
Were you aware of like the kind of like great political change that was going on in the 70s and like the impact of La Clinica?
Right. So I only know because I've read about it,
Mm-hmm.
and I've heard a few times when I've talked to some people at La Clinica. But I do, from whatever little bit I've read about it, and I have, known the names like, Cesar Chavez or Dolores Huerta, and I've heard some stories of, even from Jane and other people that she knew, and, the predicament of the fruit pickers. We sit at our dining table and enjoy the berries and the oranges, and not once knowing how it is picked and what happens to their children, and if there was any healthcare access. And I've heard stories where in Central Valley, there were bus full of people brought from Mexico in the fruit picking season, and the conditions that they worked under were inhumane. Not only that, they did not have access to schools for their children, or they didn't have access to healthcare for their children. They had to literally walk if they needed anything. And nobody even thought one time at eating that berry or the grape or whatever it was, or orange, that how much work goes into that, and who's taking care of them, and it was like when I heard those stories from people at La Clinica and generally, that there was no awareness, because sometimes when there's no awareness, people don't think how the fruit is coming to your table or how the vegetable is coming to your table. And we always undermine what the farmers do for us or what the fruit pickers do for us, because I'm sitting here all fit and healthy because I'm being able to get all these nice produce to eat or any of these things, So when I know that Cesar Chavez was the first one, and Dolores Huerta was the first one to think about the civil rights and the equal opportunity to healthcare access, or just humane conditions for these people who are living here, and nobody even thinks about them. They're completely ignored communities, and nobody even asks the question, where is all these things coming from? There were no robots at that time for sure.
Yeah.
So, and the unionizing of by Cesar Chavez of these workers, so that they can ask for wages that are equal wages, or even the healthcare benefits or some benefits, because this is backbreaking work.
Yeah.
Not everybody's capable of doing this backbreaking work, and as a society we need everybody. We need a astronaut, and we need a fruit picker. Everybody is important, because that astronaut cannot be in space if the fruit picker didn't pick that fruit and bring almonds to you or whatever so we forget that how much we are connected, but at the same time a certain profession or whatever or work is just so devalued, and that is the work that makes you more valued, because you don't have to go pick your own fruits.
Yeah.
Otherwise you won't be able to study or go work.
Yeah.
Because we all need to eat. We cannot have this one pill that we can swallow and say, okay, meet me after a year and my stomach is going to remain full for 1 year. Right? Nobody's invented that pill yet.
That is sad, but it's true.
Right? That's how we all have to work, because it's like we have to feed ourselves, right?
Yeah.
If we had a magic pill, then this whole living would be kind of non-existential. None of us needed to work because we only needed one pill in
Yeah.
the whole year. But that's
Wow.
not the case. So we need everybody, and so we need to take care of everybody, and that's what I really admired about these people. And then
En
of
la
course,
clínica. You mean?
yeah, these are the stories I heard, and I used to go back with so much enthusiasm and tell my husband, I have no complaints in life, no complaints, because look, such inspiring people I work with, you know. And of course, you know, Jane joined, and before that, these kids from Berkeley who came to Oakland and saw all these people. Some of them were illegal, some of them were refugees. No, where do they go when they're sick?
Yeah.
Because even now, even today, if you drive in Berkeley or Oakland, you go to Home Depot, you'll see people waiting outside. These are your undocumented people who will come to your home and do your yard work, and you pay them cash. But at the end of the day, when they're doing the hard work, they hurt their back. I'm not paying for that.
Yeah.
I just paid him $50 to do it. Now he has this backache that's not going to let
Doesn't
him work
heal,
for
he's
the.
on.
Doesn't heal. He has lost his livelihood. Where is he going to go? Get his back fixed.
To la clínica.
Yes. So what I'm saying is that we have such narrow vision. Like this person who's coming, you don't know if he's picked him up out of from Home Depot. Did you even bother to ask him like how is he living his life?
The other thing is, some people don't want to ask because they don't want to be involved. You know,
Yes.
they heard that if they listen to the story, they have
To do something.
to
about it.
to respond,
Yeah.
and sometimes they can not do it.
Yeah.
That's this another
So
way.
yeah, so you know, I think these were like the pioneers. If they didn't organize, then that would not have like the students from Berkeley who were instrumental in starting La Clinica. La Clinica literally started with the students from Berkeley.
Yeah.
They came in and then they collaborated with the physicians who came and donated their service hours and said, okay, let's get these people started in a mobile van, and then maybe just a you know, like a mobile home or a you know place office, and then into a you know
Yeah.
roots took place, and there's so much demand.
Yes.
And if it's not a culturally sensitive place, then even today I see the fear in an undocumented person saying, if I say something, maybe I'll be deported.
Mhm.
So even if I have this illness, I'm just going to keep quiet.
Yeah.
I don't want to go anywhere. I don't want to give my information unless until they have this safe place where they can come in, no questions asked. You know, what you going to do? And of course, if Jane, when she came in after that, you know, there was in the 90s there was this huge thing going on about they were not going to give pregnant women medical coverage.
Yeah.
Pete Wilson, the governor, came up with that, and that's why Jane sued him and
Yeah.
said, look, now you want, where are the pregnant women going to go? They're not going to be able to pay this bill.
Yeah.
They're going to, you know. So things like that, if you are a developed country and you cannot even do basic stuff, yeah, okay, people are here. How they are here, we don't know. That's not our question.
Yeah.
Question is, how are we going to help?
Yeah.
Because they're already here. Now, you know, that's what I always tell my staff too. We are not here to judge, we're here to help.
Yeah.
Just be very, very, you know, happy that you're on the other side of the line where you are able to offer help.
Yeah.
Because, you know, when somebody new comes in, they're like, oh, Dolly, this XYZ, you know. Like, okay, did the registration department qualify them for this particular category? Then that's their particular category. I don't make that decision, I said, you know.
Yeah.
Because sometimes when they see certain things, but you don't judge the book by the cover, okay? You don't know because somebody's wearing a fancy watch, that means they have a lot of money. You know what I mean?
Yeah.
So that's another lesson I've learned in my life. Do not judge, because that's not your place.
Yeah.
You know, you can't, you know, just because I'm smiling doesn't mean I'm happy. Okay? So when I hire people, especially when they're new, this is a part of the orientation that goes out to them, because I know some, not all, but some people will come and tell me that Dolly, XYZ is, you know, because they're new, they don't know,
Yeah.
you know. I'm like, you know, guys, that's not your job, that's not my job. My job is to hand out medications.
Yeah.
And if you see that's they're qualifying, that's the income level they are, and this is what they qualify for, then that's what they qualify for.
This is very good. You are focused on your, but at the same time, you are focusing in your profession and your duties.
Yeah, because that's what we are here for.
You can help the people.
Yeah.
That's good. That's good. We have I wanted to mingle the 6 and 7 question because you has been answered. But one is, why was Fruitvale chosen as an initial site of the clinic? And I don't know if you really know the story, but I want to also this that you have telling us you play a significant role in establishing and shaping the pharmacy department of La Clínica.
Yeah, so when I came in, so we had a small operation. So first of all, why in Fruitvale? Because we have a lot of Latino community, Chicano, whatever they call it, all here. Because I think they probably have their relatives here, or I don't know what the thing is, but it kind of tends to attract Oakland, the surrounding neighborhoods. And I think that's where Berkeley students actually noticed that you could see, like the day laborers that you would see wander around. Even today we have that.
Yeah.
So at that time, they probably saw the same thing. Then they found out, and the Berkeley kids, I feel, are in their league of their own. They do have, just by the fact that you're physically on campus.
Yeah, it's a bit of a bubble.
Yes. Bubble in a good way, because there's a lot of activism going on in Berkeley.
Yeah.
And when it happens when you're young, you can think out of the box. Can I apply this activism for these people that I see standing outside of Home Depot?
Yeah.
And probably that's what the students did.
Yeah.
And Fruitvale, that's a hub for a lot of illegal, undocumented people that, and California as such has been more of a liberal place. So other states, when they come here, they feel like more at home. So I think that was one of the reasons they chose Fruitvale. Now when I come in 1994, there was an already established setting for the pharmacy, but after I came in, there's this 340B program, which is a federal program that gives us access to low pricing drugs. So La Clínica qualifies for it because we do a lot of uninsured, undocumented, illegal charity care is what they call it. I don't know, I have something in my eye, sorry. So when I came in, I did not know this program very well, but I took a lot of interest, and we developed the program in such a manner that we made sure we were able to get any and what drugs that our patient needed, whether it was through a patient assistance program, it was very expensive, whatever it was. We collaborated with pharmaceutical companies, their programs, making sure that the 340B program, we leverage every part of it. That means you need to understand the program well, keep it compliant, so these discounted price drugs keep flowing in. And then we never have to say no to anybody just because we are unable to buy a certain expensive medication from our own budgets, because our budgets are also sort of, again, based on,
Very important.
We don't have unlimited budget.
Yeah.
And so within the constraint of the budget, if we are able to leverage the program and leverage the patient assistance program, et cetera, to make sure that we always have a constant supply of medication. So I did invest my time and, to make sure I understand the program, and it's a very dynamic program. It changes because how federal government changes a lot of things, and it all depends on who is on the Capitol Hill, which lobbyists are lobbying, and how pharma is feeling. So there's always changes, but we always make sure that we are on top of that, so that we can leverage the program and make sure that the pharmacy continues to have a good stock of everything we need.
It's incredible how directly it relates to the mission statement of high quality care for anyone. Yeah. It's really good.
And so the only, I feel that, and then also we made sure that we kind of expanded to all our sites, including the school-based clinics, where now we have dispensaries, which are not full-fledged pharmacies, but dispensaries. So in 8 school-based clinics in Oakland and in San Lorenzo, and then one clinic that we have a team clinic in Oakland, which is called the Clinic Alta Vista. So all these places have their own dispensaries, so the providers do not have to even wait to call in a prescription, because when you're dealing with teenagers, we're dealing with middle school people, you have an STD, here is the medication. Because that teenager, you don't have the guarantee that they're going to go to the pharmacy, pick it up.
Yeah.
Who's going to drive them? And then who's going to answer all the questions? Like, hey, why do you need this medication for? Sometimes they don't want to say why they need that medication for. Sometimes they have, environment in their home.
Yeah, can make it unsafe.
Unsafe. You can't even tell your dad because maybe the dad is doing something that he's not supposed to do to you.
Yeah.
Or a relative. So they need that safe space. And so I said, why don't we expand? And so we didn't have dispensaries. So we put those dispensaries and they are under my, my name, like, because you always have to have a pharmacist's name. So I make sure I do go to the audit, I make sure things are ordered properly, I make sure the providers are getting the support they need to dispense those, whether it be birth control, whether it be antibiotics, whether it be antidepressants, because unfortunately over COVID, it broke my heart completely when we dispensed an antidepressant for a 7-year-old. And we had to make sure we called the pediatrician and make sure that it was not an error. And the pediatrician said, no, it's not an error. This kid is so depressed, doesn't want to get out of bed because it's COVID, cannot go to school, cannot meet friends.
7 years old, isn't it?
7 years old.
But we will get to COVID sometime.
No, I'm just saying. So it was COVID, but even before that, right, if you
Yeah.
go to schools, parents sometimes are working 3 jobs. They don't
Yeah.
have time to bring their children to
Yeah.
for vaccination or a simple, physical, and then whatever else they need, multivitamins or whatever
Yeah.
it is. And so we collaborated with schools. The clinics were there, but the pharmacy part was not there. And so the pharmacy part made it easier for the doctors. Didn't have to call in a prescription. Who's going to take them?
It's a great idea to have
And so
this
the
many-
teachers call and make appointments, even if the parents could not. So now the whole community is involved. So when we say you need a village to raise a child, truly it's a village that's raising
Yeah.
the child, because it's all our responsibility. And sometimes it's the parents that really are invested, but they are working 3 jobs because this place is an expensive place.
Yeah.
Or it's on the other side of the spectrum where they are drug addicts. They don't want to take the responsibility. But this child needs their vaccination, needs their checkup, needs the vitamins, needs the antibiotics, needs that dental hygiene, cleaning. The Clinica has everything under one roof, and the providers are amazing. And my bonus every day, and my boss, Dr. Paul Byron, was the Chief Medical Officer, and my
Who
boss for
recommended you for
20
it?
20 years.
Wow. That's a great people.
And he just had to step down because of certain personal situations. Such an inspiring person, and that's just one person. I know many providers that have inspired me, and therefore I feel like, just come with a smile. There's so many people that need help. And if you want to listen to one story that has inspired me, that Dr. Bayard had. So Dr. Bayard, if he had his own office, and he has this Nelson Mandela, you know Nelson Mandela?
Yes.
From South Africa.
Yeah.
Who said, you know what, the color of the skin should not be considered as any sort of discrimination.
Yeah.
Apartheid was like, just based on the skin of the color of the skin. So after 10 years, of course I knew that he was a fan of him because he had such a beautiful painting. So his desk was right there, the painting was right behind him, and you enter his office from there.
And you see.
Always you see. So after 10 years of knowing him, I said, Dr. Bayard, I know, of course, he's your hero. But I said, is there something more than that? Is there a story? I said, Dr. Dolly, when I come to work and I see this dude here who went to jail 27 years just to prove to make a point to people that this is unfair. Don't discriminate people based on the way they look, their skin color. With a smile on his face, in the prime of his life, he was in jail for 27 years. Do I have anything like that to complain? All I have to do is take care of my patients with a smile on my face.
No,
And you know, when you work with people like this,
you don't have any choice but
it's
follow the
no, and even now today, and not to boast or anything, but my children tell me today, even today, Mom, I've never heard you complain. And I'm like, every day I go to work, that's a reset every single day. Every single day. Do I have anything to complain? Because we get audited by the pharmaceutical companies, by HRSA, by, you know, just 340B program. There's so many things that we get audited from. So it's very important and pivotal to understand the program well, because if you don't keep it compliant, they can say, hey, you breached all these things, so now you cannot have these drugs. And the consequence, like I said, is huge.
Yeah.
That means we will have to say no to many people that are
Yeah.
falling through the gaps or going between jobs. And sometimes you feel like, oh no, it's only certain like group of people that are coming as, you know, undocumented or whatever. No, a Uber driver, you know, Uber has just started to give insurance. He tomorrow has some issues and doesn't have insurance. That means he has to come to a place like ours.
Yeah.
Or an engineer for that matter, who has just immigrated from India and has come here.
Yeah.
And-
Whatever profession, even doctors.
And they fired him. My wife does not make any money. She's new to the country. She got pregnant. Where is she going? Does he have 200,000 to pay for the delivery? No. So this affects everybody. So my thing is, I have to safeguard it, the program.
Yeah.
It's a very, very important program. That means there are so many moving parts. That means there are 30 different sites that I have these drugs, dispensaries that have these drugs. That means I have to make sure that I go audit, make sure nothing is walking away. Because a drug that costs, say, $800 is costing us, say, a few hundred, like maybe a couple of $100. That means I want to make sure that it's not being like sold somewhere outside.
Yeah.
You know, it's not walking away. That's my responsibility. If somebody is giving us or trusting us to give this almost free drugs,
Yeah.
then, you know, to keep the program healthy and thriving and compliant is my responsibility, which is a lot of work.
Yeah.
That means I have to train everybody properly to make sure, including the providers, including entire La Clinica staff, just to know that this is a program and it's a, you know, needs compliance at all levels. And so we have trainings that are every year we train, and then providers that know what kind of documentation needs to be in patient profiles when we're dispensing these drugs, or, you know, in the dispensary setting, or even administering, like when I go to this and I get like a implant for my birth control,
Right.
make sure, you know, that all the documentation is proper, to make sure that if we get audited, it was given to a registered patient who had certain sort of, you know, qualification to receive this such deep discount,
Right.
you know, all those things. So it is more of like a legal and business kind of stuff, but it's very important, because if we don't take care of business, then we're not going to be able to give this discounted drugs to anybody.
Right.
And we have also collaborated with pharmaceutical companies to make sure that we are also making sure that we are not breaching anything from what their rules and regulations are as well.
Yes.
And that if they audit us anytime, we have a trail that says the drug came in at this price, it was given to a qualified patient, and prescription came from a qualified provider. Even though it was given at Walgreens, the patient and the provider, everything was eligible. So there's a lot of monitoring that needs to be done.
This is a personal, like, I'm just curious, but has, like, I know the Biden administration recently passed some things to do with, like, pharmaceutical drugs, and, like, they can now negotiate. Has that helped, or have you seen any effects on that?
So one thing we have to always remember, that the pharmaceutical companies, when they reduce the price for regular consumers that are insured, the pricing, the discounts become less for the 340B program. So it's a very fine balance. So the way it's set up is like that. So therefore our 340B discounts have gone less. Because now that the Biden administration is trying to save money for people who are insured too, like Medicare is an insurance.
Yeah.
Medical managers is an insurance. So, nevertheless, in state of California, we're doing good because now with Governor Newsom has this new pharmaceutical coverage, like the pharmacy prescription coverage for most people can qualify now. But like I said, there are still people that need because they don't qualify and they lose a job, they do this.
Yeah.
Life happens. Accidents happen,
Yeah.
you know. So all I can say, it's a mix of art and science and legal mumbo jumbo in terms of this program, because so many factors affect it, so many lobbies, whose Republicans are in power, Democrats in power. It affects it in different ways. So sometimes we feel like Democrats are doing good, but for this particular program, it has the reverse effect. And yeah, but like I said, overall we still have the discounts, and we have options because within the same class of drugs, the one drug will be sometimes $300 even for 340B pricing, but then there will be another drug coming from another pharmaceutical company that is sort of equivalent and which is like less. So what my job is to make sure, keep an eye always on what is where, what is going up, what's going down, what can we stock while it's going down.
Yeah.
But we also, because it's a, again, it's a discount program. When you go buy a dress at discount, it's not probably in fashion. The same way, when we are getting discounted prices, sometimes we're getting short expiration dates, only 6 months. So I only can stock up that much because after 6 months it's not going to be of any use. So what I'm saying is sometimes when charity you get something that's not always,
Excuse me, my stomach.
Yeah, no worries, but you're hungry.
No, well, it's not hungry. It's if I don't do anything, it's not properly hungry. But if I don't eat something, my stomach is protesting, and
So
it
please
makes know everyone that I am here. I'm your stomach. But I don't know if
I don't know
you
if I
have.
answered your question.
No, you did.
So it's a multifaceted because I also oversee monitoring at our 22 contract pharmacies, plus the 9 dispensaries we have, plus the 2 in-house pharmacies, plus all the 30 sites where the drugs are, and they all have to follow certain rules and regulation. So it's a huge operation.
Yeah, I wanted to say if you have a question of the following question that you have had to see with epidemics.
Yeah,
The
COVID.
COVID-19.
Yeah, but before the COVID-19, I wanted to know. I know that you weren't aware of the HIV/AIDS epidemic,
yes.
but you have a backlash of this because at that time you see a lot of patients. But what I wanted you to see if you can give us a synthesis of these 3 epidemic that we have lived until now,
Yes.
like AIDS, H1N1, and
Monkeypox, we had monkeypox too, and then COVID.
now COVID. But you have monkeypox
After
before.
COVID,
Oh, okay, but
they're all viruses.
yeah. But we wanted to know how does a specific epidemic take you, because when AIDS it wasn't too much experience and something so big, and then H1N1
Yes.
came, and then COVID exploded and changed everything.
That's why we need masters in public health or public health.
Yeah.
So let's start with this. Public health is so important.
Yeah.
And I think in this, era of technology, I think people in power or the politicians we elected, some of them probably didn't pay too much attention because it was not an epidemic, even though I think HIV/AIDS was an epidemic, but it did not affect general population. It affected still, kind of less number of people compared to what COVID or H1N1 did.
Okay.
And therefore a lot of people didn't know about even monkeypox because it's again limited to only a certain category of population. So, but COVID, let me talk about HIV. Even when we had the HIV, there was a lot of discrimination to the minorities, lot. You know, the more affluent, light-skinned people, you know, they had the priority. They had access to these very expensive treatments, because when the new treatments came out, they were very expensive. Talking about thousands of dollars a month. So I remember initially when we had come, there were a lot of people who had issues qualifying, but I think we are fortunate that we live in California. California had a program for people who are uninsured, undocumented, illegal, to apply for this program that will help them receive their medications for HIV/AIDS, because again, if they're not treated, they're going to spread it to other people. Because you know, there was so much stigma attached. People wouldn't even tell anybody that they have HIV.
Yeah.
So you have to come put yourself in shoes of the person who has HIV, who are a minority, do not have proper access, don't know what to do about it. They are feeling very ashamed to even tell anybody, but at the same time they are not educated enough to protect themselves so that they don't spread the disease. And there was a time when that has happened, and therefore we had a huge surge in the earlier years, because minorities were not educated well about this disease. They didn't have access to the antiviral drugs that they needed. They didn't have the support groups that they needed. And there was a huge disparity, I would say, between the people that were insured, you know, coming from affluent, or even where they had access, versus minorities. So they went through a rough time, and I'm sure their families went through a rough time. Because
For sure.
I have noticed COVID, and I'll come to that, H1N1 was not that much of a big deal for us, because not that many cases were there, and we had the antibiotics that we needed, and there was, you know, approved treatment for it, because there was H1N1 in other countries and they knew how to deal with it. So fast forward to COVID, so there was so much myth about COVID, you know, and nobody knew how it was spread. And just for FYI, pharmacy staff, providers, pharmacy staff came to work every single day, because medications were supposed to be given. Our patients live in neighborhoods where medications, anything that you put on the doorstep gets stolen. Forget about medications. So there's no option for home delivery for medications. So we were open every single day that we are open on our regular timing. And our patient population, I think 50% of our patients had COVID. 50%. We didn't know where the funding was coming from. You know, our Dr. Bayad was like an amazing leader through COVID. We somehow put our own workflows in place. We, you know, sprouted vaccination booths. We had ex-providers and mid-levels who came and started giving vaccines to people.
Continue.
Yeah.
Continue.
And it was just like, you know, every day there were some great ideas coming out, and we had this, you know, sort of huddles every day on the phones, saying, okay, this is what's happening, this is what's happening. So many people are falling sick at work. How are we going to manage the next day? You know, because literally people were falling sick, either they're getting it from home or, you know, somehow, somewhere. And so we were operating every single day with that N95 mask. And sometimes 3 people doing work for 10 people, and talking became harder. Couldn't breathe, felt lightheaded. And we worked every single day, and we had this pediatrician that was like so compassionate and empathetic, that she's like, Dolly, this kid is sick. How are they? You can't wear like an infant wear a mask.
Yeah.
And they live in a 1-bedroom apartment with aunts and uncles. There are like 8 people living in this apartment. They're all going to end up having COVID. So I'm going to tell the parents, please don't venture out. Can we deliver some groceries to them from somewhere? I'm like, good question. Said we should be delivering medications, or if one of us goes and rings the bell, maybe we cannot leave that at their doorstep. And she's like, yeah. I don't know where she did, but she found a grant, And now, so we had this whole thing going. Because see, usually for pediatric patients, all our pediatricians came to work, just like the pharmacy staff. Because a little 10-month-old baby, you cannot do telemedicine.
Yeah.
The baby can't talk. Baby doesn't know what is going on in the body.
Yeah.
They need to examine, see the lungs are doing good. So they always came in person. So the doctor is wearing PPE, we are wearing PPE, making sure, meeting them outside, giving them the medication, and providing them with groceries.
Wow.
It's an amazing program.
Did you find that because you had like personal connections with people that they were more willing to like take the vaccine? Like I know vaccine hesitancy was kind of big.
Yeah. We had like almost 98% vaccine, both our employees and our patients, because our patients feel like more like family when they come there saying, oh yeah, if Dr. Bayer said, I must take it, because they know that they've always looked at their interest. Or Dr. D. Harling, who's a pediatrician, said it, we should take it.
Yeah.
Because they have that much faith and trust that this is for our good.
Yeah.
And especially when you have small homes and lots of people living, there'll be 6 months of COVID there.
Yeah.
One person gets better, this other person, if you don't take vaccine,
Yeah.
you know? So things like that, so you have to look at the community you're serving and accordingly pivot and, you know, adapt and offer services. That's what La Clinica does. And that's what I like about La Clinica is the providers are so creative and so compassionate that they're looking at the big picture. How do we, and the other thing we thought through COVID is our patients are the patients that are your waiters, your gardeners, your home help, or come and clean your home. Okay, so you think you're sitting in your palace, but when somebody comes to clean your home and he or she has COVID and they don't know they have COVID, I'm sorry. You're sitting in your mansion, you're going to have it. Because
If they know it doesn't have acute symptoms, they won't tell you.
that's what I'm saying. So what I'm saying is when people say, oh, why don't we need to take care of this community? Because we're all connected.
Yeah.
You go to a fancy Michelin star restaurant, the waiter there, he needs to come to make that shift because he needs to feed his kids. Now he has a little sniffles, he's going to be there. But where is he going to get his vaccine? Where is he going to get his medicines when, to get better?
Yeah.
At La Clinica. So that you can have a good Michelin star experience. But people do not connect these two dots is what, it's just unbelievable that people, if you connect dots like that, it should be so easy to put back in the community and easy for all these people that are elected in Sacramento and in Washington DC to make decisions.
Yeah.
That why do you need to serve these communities? Because public health, so that all of us remain healthy.
Yeah.
And when public health fell through, that's why we got COVID. To tell you the truth. That's why, because we forgot about public health. We said, why do we need to fund public health?
Yeah. I would say that they don't forget public health.
What
but
I mean-
it served to
No,
the other
they
way.
did forget public health because there were so many warnings of COVID coming up. They were complacent. They were not ready. Look at the first responses. And and that's when pharmaceutical companies came through.
Yeah.
When they developed that vaccine expeditiously. They were already working, but the government and the public health should have already developed it. Because there are so many people who are already talking that one of these days, the smartest of the people, even Bill Gates I've heard him say so many times, that America is not ready for a pandemic. It can be any kind of pandemic.
Yeah.
Public health has to be ready for bacterial, plague, virus, everything. But what I'm saying is, because when you don't fund public health, it's not like, I don't want to do it, but if you're not going to give me the funding, people are going to quit and say, I'm going to do something else because there's no jobs in public health.
Yeah.
And then when people like Republicans come, they call the doctor that helped us, you are out of your mind. We don't need all these things.
Yeah.
So what I'm saying is, There's a reason that was thought through why public health is so important, because if I have COVID, can I go to my pharmacy and help other person? No. So I need to be protected, so do the other people need to be protected. Everybody needs to be protected for all of us to function as a society.
Yes.
So you cannot say that the waiter should not get the vaccine, only the CEO should get the vaccine. Because the CEO is going to meet the waiter at the Michelin star, and then he's going to get it too.
Yeah. And he can die.
And he can die. So I'm just saying that that's why public health is so important.
Yeah, it is. It is. Wow, this is incredible. You know, you are given to the people that will hear that you are doing the treasure. I'm very happy that you are here. We haven't finished. Next.
What are your career's most significant success stories or achievements?
So, like I said, I feel so fortunate. Every day for me is a learning opportunity, serving opportunity. And I've had some really heartwarming stories. Like one of our pediatricians was treating this critical case that we got from Oakland Children's Hospital, and our pediatricians are affiliated with Oakland Children's Hospital. Sometimes we get some critical cases that come to our pharmacy to pick up medications as well. So that's how we get to know their life. So, you know, we had this patient, and the parents were like so sort of peaceful because everything worked properly. And this was in the first 2-3 weeks since the child was born, and he had this condition, and the pediatrician was so proactive. He was there when the child was born and made sure everything that he needed, because this were again young parents, didn't speak the language. The doctor was there to navigate them in his own time. He would come into the pharmacy and make sure, Dolly, do we have this ready? Do we have this ready? Because we're transferring this patient's, pharmaceutical needs here. And then the next thing I know is that the baby was named after the doctor.
It's beautiful.
You know, what more can your service, what you did, touch the parents so much? That's a life-changing, for me, it was life-changing. That somebody can so much respect and adore, touch their life in a positive way, in such a way that they want to name the son after the pediatrician. And I thought that was the biggest gift anybody can give you.
Yeah.
Yeah?
Biggest honor.
Biggest honor that somebody can give you.
My child will grow up.
Yeah?
Knowing the story of the clinic and
Yeah.
their own scheme.
Yeah. And then, I have just such very heartwarming stories. And that makes me more of and when I recruit people, you would not believe. Currently, the pharmacists that I have, except one pharmacist, are all from UCSF, which is the #1 clinical pharmacy school. I'm competing with all the elite institutions to hire them. I get them on the basis of what miracles they will get to witness, and how as a person you will get to grow, emotionally, spiritually, how your emotional IQ will grow by leaps and bounds if you stay in this kind of an environment. And therefore I never have the dearth of good people that I can get to work with. And one of the pharmacists came to me from UCSF, and he said, Dolly, tell me when you have an opening, because I only want to work for a clinic like this. And I said, why, James? And he said, Dolly, I grew up in a neighborhood in LA. Parents were immigrants from Korea. Didn't speak the language. Dad was used to, like a facilities guy, would take care of buildings and stuff like that. Mom did not speak a single. Did not even know that they can go find healthcare somewhere. Says, if I fell down, and the one time he broke his wrist, parents got so angry at him, saying, why we told you not to do skateboarding or something. He went to a neighborhood pharmacy and the pharmacist helped him, even though it was an independent mom and pop. He didn't take any money from him. He gave him a bandage. He did what he could.
Yeah.
And then starting then, I think he was about 7 or 8 years old then. Starting then, for any health care issue, he would go to the pharmacist and ask, because the parents had no idea.
Yeah.
And he said that's why I became a pharmacist. So that's what I'm saying, your experiences in your childhood just shaped the world for you.
Yeah.
And then I just recently hired a pharmacist, and he lives around Coliseum. He came from Mexico at the age of 9. He went to actually University of Michigan, which is number 2 or 3 pharmacy school in the world. And he's like, Dolly, I was a patient at La Clinica. And he works at CVS, and he just didn't want to work there anymore. As soon as I had this opening, he applied. And I'm like, where can I? So I want people like this, because you can't teach empathy to people.
Yeah.
You have to have a little bit before you come.
Yeah. We can shape it, but not create
You
it.
can't. It's like taking the horse to the pond and you can't make him drink the water.
Yeah.
You can create this environment. So therefore, when I'm hiring people, so these are when I hire a good person, that is a highlight of my career, because I feel like I have brought in a good, valuable person that will keep giving to the people that need to receive that thing, or the service that they need to receive. So that is a proud moment for me when I find a good fit for my staff, because that's the legacy I want to leave behind. That good people, I want to hire good people. Because degrees everybody has, but it doesn't hurt if they're coming from the biggest clinical schools, because I need people with very sharp clinical knowledge, because our patients have very few words in which they can explain things.
Yeah.
And in very few words, if you know what they're saying, then a sharp person can know what the treatment is, or what the help is.
Yeah. It depends on all of this
Yeah.
kind of whole clinical.
Yeah.
Clinical.
So the clinical is good, but they're good with people's body language, because they're so empathetic. They have a good emotional
Oh my
IQ.
God. Wait. Something happened here. Memory is full.
That's okay, but you have this going.
Die. Okay. This is going.
But I think that is some of my highlights, and it just enriches my life too. I will give you one example that broke my heart just recently. A family medicine doctor called us, a 12-year-old who was 6 months pregnant, not knowing that she was pregnant. Not knowing that she was pregnant.
Yeah.
And the only reason she found out was because the dad was told by the neighbor saying, why is your daughter's tummy so big? She was a refugee. If she's not going to school, anything. Dad said, I don't know. Later on, we find out that somebody was abusing this girl in the same household where all these refugees guys are staying. And the pediatrician calls me saying, Dolly, how are we going to, because 12-year-old.
Yeah.
She needs mental health issues, what kind of titration we need to do on her drugs, because her weight is so low, but she needs all the support she needs in terms of the vitamins and everything and other things. What all then can we give her can we give her an antidepressant or not? How can we help her? And when you're 6 months pregnant, then we have to check a lot of drug interactions, because it can probably negatively affect the fetus.
Yeah.
So when a call like that comes, it's heartbreaking, but an opportunity to stand up and say, I've never done this. James, you're very good at clinical research. Let's get things ready for the provider. What are the options? What can we titrate here? How can we get her the best treatment?
Yeah.
So I'm looking at the professional part of it. How do we up our game? But heartbreaking, but yes, how are we going to make this okay for this particular person?
What can you do? Yeah.
Yes. So what I'm saying is, these are all my highlights of my career. And also safeguarding the 340B program is my biggest highlight, and hiring good people is my biggest highlight, and also always making sure that every single medical provider any person throughout La Clinica who has a question or any sort of medications, whatever, my staff is fully trained and equipped to answer any questions related to drugs, whether it be how to store it, how to discard it, how to use it, how to titrate it to somebody's level. And that's my responsibility to keep my staff motivated in every way so that they can do their best when they come to work every day. Because sometimes it can be dampening when you hear things like that. Some people get really sad.
Yeah.
You know, for a moment you get really sad. Like, you know, what kind, you know, society are we living in?
Yes.
You know, for a minute you not judge, but when it's
Do because she's gonna end up going back home there.
yeah, you know what I mean?
Yeah.
And that's why I'm like, not only respect the doctors, but literally adore the La Clinica doctors. Because that doctor called me, she called the mental health, and we had this whole, within like half an hour, the entire network was communicating with each other, saying, how can we help this circle?
Yeah.
You know, how can we protect her going forward? Like the social services, everybody, so she doesn't even have to go back. Somehow we're going to take care of her. And so this is the highlight, is how can we get people together and get things done, you know?
I'm going to stay here because I feel safe if I am looking that it's recorded.
That's okay.
So what lessons have you learned from this experience that you think might be valuable for other organizations that serve Latinx communities and just underserved populations in general?
So the biggest lesson I have really learned is that as human beings we are more alike than different. That we all aspire to have the same things. Whether you ask a waiter, whether you ask an engineer, whether you ask a student, whether you ask a homeless person for that matter, what are they wanting? They want good human connections, they want to be healthy mentally and physically and emotionally.
Yeah.
They want a better, you know, world for their children than what they had. They want a home, they want a family. These are all, you know, and if you as an institution are a critical link in facilitating any one of these aspirations of the human capital or the human population, if you can do even help in one little thing, I don't think so you'll need a bigger reason than that.
Yeah.
None of us need a bigger reason, because I think change happens in small increments. If I can, like for the climate change, I said, what can I do? Okay, from that day I've stopped using any sort of plastic. Can I not use plastic? Okay. Some people might say, oh, that's not a big change. But if thousands of Dollys do that, that's a big enough change.
Yeah.
Right? So that is what I feel like, even as an institution, if you can do that, like a small change in somebody's one aspect of their life, like for La Clinica, the health aspect of it, mental, physical, emotional, you know, in whatever way we can help, in any department, doesn't matter, in pharmacy, in social services, in mental health, in lab, because I need my lab test to know what is less or what diagnosis I have.
Yeah.
You know, it's like you build this human being who can become the next changing thing in the world, can change your life, because he or she can now be a contributing citizen of the society, but he or she does not have good health, mental, physical, emotional. He or she is going to struggle. But if you
Yeah.
want a good contributing citizen, then as that institution, you can be a short part of his or her life to get him or her there, you
Yeah.
know, to overcome whatever little bit that you can overcome. Because I truly believe that if you give a person an opportunity, they will contribute in whatever little way they can, or they can contribute like Elon Musk, who knows? You know, he has his negatives, but he also has his positive. Or, you know, somebody like Mahatma Gandhi, who knows? Or Cesar Chavez, or, you know, because everybody's contribution are
Yeah.
equally important, doesn't matter. But what I'm saying is, if a person who is not feeling good health-wise, or a mother who's not feeling good, how is she going to raise a child that's going to be healthy?
Yeah.
So I feel like health is so important to making us feel good about ourselves. Because I'm having a constant tummy ache. Can I focus on this interview? No.
It's true. It's you know, health is everything. You know.
Health is wealth. The other wealth that we get is also important for our physical comforts
Yeah.
and the food that we eat.
Yeah.
But this health is wealth for your overall, as what kind of human being you are, because you can be then the negative effect on the society too.
Yeah.
Because the mental health, if it's not good, you can kill someone.
Yeah.
But you didn't have a chance as a little kid to have an institution like La Clinica where you can get treated. So I think institutions like La Clinica have such a important part to play, and going forward with this whole online and social media and so much of I forgot to tell you, COVID, mental health went through the roof. 30 to 40% increase in mental health issues.
Yeah.
And I'm sorry, but robots cannot help counseling people. People need human touch. The lack of human touch and the increase of human screens are causing an epidemic to a level where a 2-year-old has been being entertained by an iPad. He or she is going to have a lot of issues. He or she is not going to be able to read the body language of a person.
Yeah.
So people, like healthcare, where we actually hold hands, where you go see a provider. Yes, the provider can use AI now, because then he can actually spend that 30 minutes looking into your eyes,
Yes.
asking you what is wrong.
Yeah.
Because the AI is doing the diagnosis from your data and saying, doc, this could be the top diagnosis. So the doc has more time to look at you,
Yes.
talk to you.
Yeah.
So that's what technology should be used to your advantage. So places like La Clinica, even with AI coming, the need is going to be even more.
Because now you can see more people.
Not only more people will need to be seen. Because the only human interaction perhaps they'll have during that day is either your mental health provider or your doctor or a
Yeah.
nurse or a pharmacist who's, because there will always be people with language and cultural sensitivity and requirements.
It is true.
So, somebody like you can order from Amazon your drugs, but somebody who just came from Guatemala cannot.
Cannot.
Because first of all, they're living in very unsafe space. That thing is going to disappear. Second of all, they need to be taught how to use the thing, how it works in their own language. And that happening through a screen, that pharmacist cannot see your body language.
Yeah.
Doesn't know how they understood it or not.
Yeah.
When I look at you, I know that you didn't understand it. Your body language tells me everything.
Yeah.
Okay, and that you can't replace the actual human touch with any technology. Technology can be your friend when it tells the doctor, okay, the doctor does not have to order 10 tests because
Yeah.
technology is telling you only order this one test, and these are
Yeah.
the things based on all the millions of data that we have, right? Then the doctor can actually talk to the person and say, hey, because like I'll tell you what, all these manifestations of diseases is the psychosomatic. What happens in your mind and your emotion comes through as chronic diseases. They're all preventable. Every disease is preventable. But the problem is we're not proactive. We are reactive.
Yeah.
In medicine too.
That's true.
In our systems, it's institutionalized to be reactive.
Yeah.
So these institutions can be more proactive and be empowered that you're really, really making a positive impact in the communities and the most vulnerable communities. So they should not go anywhere. They should be right here. And in fact, the advocacy has to be much more stronger, because believe it, again, the disparity in wealth and in access, the communities that are vulnerable are going to have an epidemic of mental health.
Yeah. Well, we have it already.
But they're going to even have more, because they have the phones, but they don't have the required mental health access that they need.
Yeah.
Whereas a rich person's son or daughter can go to the best addiction rehab.
Psychologist, psychiatrist.
But a waiter's daughter, the waiter will say, look, see more on the iPad.
Yeah.
So we need to educate even the parents. And who is going to do that? Community health centers like that who can culturally, quality, affordable health access and a holistic health access.
Yeah.
Not, don't let the problems be created. And La Clinica does that. We have those pomodoros or whatever where they teach you how to cook, how to lead in. They, arrange for hikes, take your children outside. We need more and more of connection of new generation to the nature.
Yeah.
Get away from these drugs. You don't need these drugs if you eat good, healthy food. Produce, healthy produce, good quality meat if people are eating meat. That's medicine.
Yeah.
But you don't eat soda and chips that all these people are. Because again, it all comes down to business. Why do we even have to have Coke in this world? Drink water. But we can't see. This is a capitalistic society. We cannot say no to that.
Yeah.
But institutions like ours, community like the most vulnerable communities, have to have a good safety, human safety net that says, like you guys, the students should set up a program.
Yeah.
Let's help a 2-year-old. Let's go and volunteer with this parent and explain what the consequences of these social media are.
Yeah.
So that your child does not have mental health issues. And those mental health issues are going to have physical manifestations. Where you will have diabetes because when you're stressed mentally, you will have diabetes because your pancreas don't secrete insulin like they're supposed to. When you're having panic attacks, you're going to develop high blood pressure after a while.
Yeah.
Because your arteries, your heart is not going to be able to take that.
Yeah.
The palpitations and everything. So what I'm saying is everything is psychosomatic. So in these communities, vulnerable, any minority vulnerable communities, and I'm not excluding the Caucasian community too, they, any community I'm saying, everybody, but depending on the income level, now if you compare the zip code and the well-being, it compares really well.
Yeah.
So, we are sitting in Berkeley where activism is at the center of it. Activism is required even more in the times of AI to advocate for the new generation, because otherwise we're going to sacrifice them to these technology companies, and they're doing good. Okay, so now Elon Musk came to my mind because of course Tesla is contributing a lot to the green movement, but at the same time Instagram is not. They're making a lot of money out of ads, and people are getting addiction because they are employing 30 psychiatrists to see how we can keep these kids addicted, how the platform needs to be changed so that we can addict the kids.
Yeah.
Right? So, but we have to use technology to our advantage.
Yeah. Yeah.
So, but who tells them all these things?
No, there is right now the people who advocate for read more, less telephone.
No, but the
crazy.
Center for Critical Study of Health of Latinx Community should have a chapter through the students where they can have sessions in the community where you can bring some leaders from community, like it could be a couple of moms.
We do that.
Yeah.
And as this, we bring, when we did the Dolores Huerta event, we bring people from the community
Yeah.
that they are not so known as a community activist as a Dolores Huerta, but we mingle with them. We also bring people from the Central Valley, Huron City. We bring the mayor. We bring the children to exchange here.
Yeah.
Well, children, teenagers, and we also bring their parents.
See, because you have to empower. See, people, helping is a different story, which La Clinica does. But La Clinica cannot be in their homes.
Yeah.
So what I'm saying is when parent is not empowered, the child is not going to empower.
Yeah.
So some responsibility needs to be transferred to the parents as well, or the caregivers. Because, okay, I give you medicine, but it's your responsibility to make sure a child is taking it 3 times a day. I can't come and give that.
Yeah.
So what I'm saying is, how do we improve that? We improve that when you start mentoring a 2-year-old so that he or she becomes a responsible person and knows to shoulder their responsibility and not say, okay, La Clinica, take my responsibility. No, La Clinica will only take that much responsibility. But that is, I think, as a community, as a society, that's our responsibility to, empower women or whoever it is to make sure that they empower their children. So that
we are trying that.
Yeah.
It's a suggestion that we plan to, we will enrich with your comment because it's I believe in that.
Grassroots changes,
Yeah,
small, it doesn't big, it's not big.
Yeah.
But every child, if he or she is kind of given that environment to thrive in a positive way, he or she will automatically be different than their parents.
Yeah, that's true.
Automatically be different. And like I said, I believe children are, you are as an adult who you are when what you experience. The same thing, if you have a childhood trauma, it manifests in so many different ways when you're an adult.
Yeah,
Because when you're a child, you did not process it, you just shoved it down. But then you don't know why certain of your behaviors are like surfacing in your adulthood. But if we can help in any way at that level,
Yes. Then
Yeah.
like produces generational change too.
and the young kids like you are so relatable to younger kids.
Yeah.
Rather than a 50, 60-year-old saying something, if a 20-year-old says to a 7-year-old, they're more interested in listening. Or even a 15-year-old, they're more interested in
yeah,
listening. Yeah, because it's more relatable.
It reminds me of what you said earlier, like it takes a village. Like you have to really like work together
Yeah.
at all ages and like
Yeah.
make it a true community. Like I think that's something that's really inspiring about La Clinica is that it's a community.
Yes.
You can feel that.
And people, we have generations, we have like third generation coming to us.
yeah. Let's do the next question. I think it's
The last question I have is, what has it meant to you to work at La Clinica?
Oh my goodness, I tell you what,
this is a big question.
it has been after my parents. In terms of, I should not even compare that, even a bigger influence than my parents, because it's opened up so many avenues as a human being to me. Because everybody works, everybody eats, everybody sleeps, everybody goes to the movie, everybody has children. That's living life at the very base level.
Yeah.
Okay? What La Clinica has done for me has elevated the experience of my life. Life every day, every single moment. It's elevated because you are more awoke.
Yeah.
You just feel like, oh my God, this is an opportunity for me to improve myself and improve other people's life in any small way that I can. Any small way. Even I tell people, when you give out medications, truly believe that hope the person feels better.
Yeah.
Just saying, oh, I hope you feel better. No, the intention has to come from within. It's not just saying, hi, good morning, how are you?
Yeah.
Believe it when you say it, that hope this thing truly, makes the difference in whatever it has to do.
Yeah.
Right? So that kind of small subtleties in life that brings you so much joy and goodwill. Small things, not big.
Yeah.
But it has truly been a very fulfilling journey, and I have met so many inspiring people at La Clinica, providers, the executive team, the people that I work with, even the janitor that I've known him for 12 years now, and he's my most favorite person. His name is Ricardo. He works with so much enthusiasm, and he's aspiring opera singer. He has such a lovely voice. And every time when I'm there and say, Dolly, I'm going to sing for you, and he has such beautiful voice. And if something is missing, you call Ricardo. I don't know, he has so much energy. Within 30 seconds, he appears with whatever you need, And when I talk to him every single day, because every single day at least I see him one time, I'm like, I still need to meet his level of enthusiasm. And the power that he gets out of the work that he does. Like, everything is spick and span, and he said, Dolly, today I need to do, can you send one of your pharmacists early? Like, I don't even have to tell him anything. He comes so motivated every day. We would not have the same experience if we were not working in a neat and clean place. So I'm more, thankful to him because he creates such a positive environment, and he's every morning so happy to come to work and to say hello to everyone. So, from CEO Jane Garcia, to Dr. Paul Bayer, to Ricardo, to that patient that sometimes just write such good messages for us, saying, thank you, you've taken care of my daughter and my granddaughter, or they bring something like, okay, they want to share their plums from their backyards, whatever it is,
Yeah.
And every experience it's such a human enriching. As a human being, I've grown so much, and I don't think so I would have in a job at CVS, at Walgreens. Like I said, I was selling my soul. I told my husband, I'm quitting. I quit 6 months before I found this job, actually. I'm like, I will, I want to help, but I feel handicapped. I'm not being able to help.
Yeah.
So I'm quitting my job 6 months. I look for a job. It's fine. After 6 months of not doing anything, I found this job, but I said I'm not ready to be in an environment which is toxic.
Yeah.
And so La Clinica has given me, I'm actually so fortunate that he has offered me this great opportunity to connect to the community, to people at work, outside, everywhere, to meet some of the finest human beings that I've met through La Clinica, and in India through my dad, who used to bring all kinds of people every day at home. You need this, okay, come at home. You need a job, okay, I'll try to help you. And through his connections, a lot more. And so it's so amazing to meet all these different characters. You learn from everyone.
Yeah.
And it makes you a better person, an open person. And that's what I tell my children too. That, and luckily both of them did not come into pharmacy, but in whatever little way, and they both have volunteered at La Clinica, by the way, both. And all my friends' children have volunteered at La Clinica, because we have a great, huge volunteer program. Because, what better place than just to let you know that always find something that you can give back to the community.
Yeah.
It doesn't have to be big, small, whatever little bit you want to do, So I'm hoping my children will get inspired. They're doing little things, but I want them to do eventually, do something. And even my husband, I make sure he does some stuff too.
Yeah.
We all try to do, even in our community, local community in Pleasanton, like Thanksgiving, Christmas, we will go to sometimes San Francisco and, feed people, whatever, little bit.
Yeah.
But I take it as a family,
Yeah.
Some healthy sandwiches and stuff, we will just take it and give it to whomever wants to get it,
Yeah.
Small things like that. And then my daughter, actually, she works for Cisco, and my son works for also a technology company, but within they're providing a lot of opportunities now to invest in soup kitchens, or go and mentor like the big brother big sister kind of environments. So I always tell my children, and through high school also, they were also part of this boys and girls team charity, where they would go foster kids, they put up programs and help them raise funds, so little small things, but they haven't dedicated their life to it.
Yeah.
But my daughter always says, Mom, I really am so jealous, or sometimes she'll say envious of your job, because now in the corporate world, she experiences sometimes you feel empty. And I said, Priyanka, I had the same feeling when I was working at CVS and Walgreens, that I decided I have to get out of there.
Yeah.
And I said, if you feel like that, that's a signal you should get out, because you will find places where you can find both.
Yeah.
So I'm trying to motivate the next generation, because I think that's what is important. The next generation is the important. The younger kids, you guys are the important, because you're going to progress and make that right progress in the world, right?
And that's what we want. That's why we have them here, and that kind of a testimony that you have given to us is the one who will stay with them, and the whole experience will be replicated in some ways.
So it's like not like it's not it's La Clinica giving me a lot,
Yeah.
and therefore I want to give the best of my ability every single day.
Nice.
It's a what do you say, counter effective it sounds, but that's how it is. When somebody gives you the opportunity that is the best opportunity, you want to give it back.
Yeah. Absolutely.
So that's why when we inspire people in the right way, you don't need to tell them, they will give back.
Yeah.
You did your job if you inspired them. That's it. Nothing else.
Yeah.
Right? So I hope even if one person gets inspired by this, your and my job is done, because that person will go inspire somebody else.
Yeah, it will. Thank you,
So-
you, Dolly. This is a
thank you. Such a great opportunity.
yeah, and